So here we have a Down syndrome baby. So Down syndrome suspected baby with Down species. So we thought we'll discuss about Down syndrome today. So Down syndrome is extra 21st chromosome. So it's like aneuploidy. There are 2 to 3 types of translocation that happens. One is complete translocation, where one extra 21 chromosome will transfer to the baby. Another one is partial translocation, where half of the chromosome is getting transported. And one more thing is translocation or Robertson translocation, where extra chromosome is not there. Like the total chromosome is 46 as it should be, but the extra genetic material is getting transported usually to the chromosome 14 from 21st. So it behaves as a Down syndrome, but if you check the total number of chromosomes, it's 46 only. And what is the origin of this extra chromosome is like 90% it will be maternal. Only 10% it will be paternal origin. So other 90% will be from mother chromosome. This happens during the meiosis period of the embryogenesis. Okay. So as it is affected by the genes, so whole of the body is affected. So whole of the body is affected. So what are the other problems associated with Down syndrome means, like it affects the GIT, like duodenal atresia, Hirschsprung disease, imperforated NS. It affects the cardiac in the form of atrioventricular septal defect, ventricular septal defect, atrial septal defect. What is endocardial cushion defect means, like it is the thing which forms the barrier in when the embryogenesis of the heart. It forms the atrial septum, ventricular septum along with the valves. If anything affect this endocardial cushion, it can lead to both ESD, VSD, and the leaflets problem also, like mitral valve or tricuspid valve abnormality can be there. So if it can affect the neurological, like it can cause the Alzheimer's disease. So the Down syndrome patients will have early Alzheimer's diseases, and it can also affect the cause hypertension, and in blood it can cause a leukemia. 10 to 20% of Down syndrome babies will develop leukemia. So other than this means, like what are the clinical features means, like one may neurologically baby may have hypotonia, delayed development, and abnormal or decreased Morse reflex. If you come to the faces, flat faces, okay, flat occiput, three frontanellae, and upward slanting palpable fissure. You can think like, okay, like if you see like goddesses, like you keep the eyes like this. So you can remember that for the Down syndrome, like upward slanting palpable fissure will be there, and epicanthal fold can be there, and iris can have brush shield spots, and midfacial hypoplasia, low nasal bridge, and upturned this thing, and lower lip may be everted, tongue may be protruding, short upper palate, and there may be dysplastic ears, and extra redundant skin may be there. On the back of the neck. Joint hypermobility can be there. So single palmar crease, as you can see here. So single palmar crease from here to here is only a single line, and sometimes spinodactyly may be there. The small finger can be overlapping, and small metaphalanges and phalanges can be there. Sandal gap can be there, where there is a large gap between the toes. Okay, big toe and the second toe. Small pelvic can be there, along with like other problems like duodenal atresia, tricuspid fistula, like these things can be there. There's something called Hall's criteria. So Hall's criteria consists of 10 things to diagnose the Down syndrome clinically. So Hall's criteria 10 things means, one is hypotonia, and abnormal morose reflex, and flat faces, okay, upward slanting palpable fissure, dysplastic ears, and extra redundant skin, and clinodactyly, single palmar crease, and small pelvis. So these things can be used Hall's criteria to diagnose the Down species. Okay, and along with the flat face. So there can be associated other problems like endocrine problem, like there can be congenital hypothyroidism, acquired hypothyroidism, subclinical hypothyroidism or hyperthyroidism, and type 1 diabetes mellitus. Okay, and there may be autoimmune diseases like celiac diseases, and leukemia can be there. Along with, there are many developmental problems like ear may be associated with strabismus, nystagmus, glaucoma, refractive errors. Okay, and ENT problems like small dysplastic ear, along with atretic ear canal, laryngomalacia, and bifid uvula, and recurrent eustachian tube causing the acute otitis medias. So these things can be there, which will further complicate, and because of hypotonia there may be difficulty in feeding, which will pose a significant problem for feeding and development of the baby. So you have to have like frequent monitoring, and dental problems like dental malocclusion or dental delayed development of teeth, or early attrition of teeth. So all this can be there. So dental follow-up, ENT follow-up, along with ophthalmology follow-up and endocrine follow-up should be there. And you may have to repeat the CBC, TSH, and sometimes celiac disease, or to diagnose celiac disease screening may also have to be done. And if you are suspecting any like sudden increase in the weight or sudden decrease in the weight, you may have to diagnose the diabetes mellitus also. So these babies require separate monitoring and follow-up. Okay, and recent thing is like you should not call them as a Down syndrome. You should call them as a patient with Down syndrome.